In this video we are going to discuss about the cholera, जिसको हैजा कहते हैं, इसके बारे में पढ़ेंगे। चलो शुरू करते हैं। In this topic we will discuss about the definition of cholera, epidemiology of cholera, causal organism, pathophysiology of cholera, sign and symptom of cholera, complication, risk factor, causes, diagnosis, treatment as well as prevention of cholera. What is cholera? हैजा एक शदीद इसहाल की बीमारी है जो विब्रियो कॉलरी नामी बैक्टीरिया की आंत पर इन्फेक्शन की वजह से होती है। What is epidemiology? Epidemiology is the branch of medicine which deal with the incidence, distribution and possible control of the disease. तिब की वो शख्स जो सेहत से मुतालिक बीमारियों और दीगर अवामिल वाक़यात तकसीम और मुमकिना कंट्रोल से मुतालिक है, इसको हम एपिडेमियोलॉजी कहते हैं। जैसा कि आपको पता है 1800 में हैजा की वबा फैली थी, लेकिन सीवरेज और पीने के पानी की मुनासिब ट्रीटमेंट की वजह से तरक्की याफ्ता ममालिक में ये बीमारी मुकम्मल ख़त्म हो गई है या नायाब हो गई है। हैजा एक आंतों की बीमारी है, जिसका मतलब है कि ये इस वक्त फैलता है जब किसी मुतासिरा शख्स का पाखाना, जिसको हम बड़ी पेशाब कहते हैं, खाने या पानी के साथ मिल जाए तो बीमारी पैदा करता है। The incidence of the disease is 1 in 1 lakhs worldwide, over 1 million cases and nearly 10,000 fatalities. Vibrio cholerae is, that it is a gram-negative bacteria and it is live in both in the presence of oxygen as well as in absence of oxygen. And this bacteria can easily multiply in water. Then what are the pathway, how they enter into the human body and how they cause the disease? So first of all, the bacteria enter into the human body from contaminated water or contaminated food, accumulated in the stomach, produce toxins. This toxin combine with the G protein, then the G protein inactivate the GTPase. The G protein stuck in on position, increase the CAMP. It activate the ion channel, so sodium chloride enter into the intestine and it produced watery diarrhea, which is the common symptom of the cholera. What are the sign and symptom of the cholera? Most people remain asymptomatic, and the symptom of cholera mostly present in majority of the peoples include massive diarrhea or watery diarrhea, stomach pain, leg cramp, mild fever, vomiting, sunken eyes and cheeks, dry mucous membrane, decreased urinary output, and 1 liter of colorless and watery fluid per hour. An other complication of the disease is severe dehydration. The skin become dry and wrinkled. The patient may go to coma, so shock will be present there. The kidney become pale and even lead to the death. These are the serious complications which is arise due to the cholera. Risk factor: poor sanitary conditions, raw or undercooked food. If we consume those foods in which is not properly cooked, so the bacteria is present there and it will produce the diseased. What are the causes of the, or we can say what are the transmission of the bacteria? So the bacteria is present in the water as well as in the food. When we consume such a contaminated food or water, the bacteria will enter and it will increase in their number in the digestive system and it produce the disease known as cholera. इस बीमारी की डायग्नोसिस यानी तशखीस हम आसानी के जरिए कर सकते हैं। तो दो तरीके हैं, क्लिनिकल डायग्नोसिस एंड डिफरेंशियल डायग्नोसिस। क्लिनिकल डायग्नोसिस: इफ द पेशेंट हैव सेवियर वाटरी डायरिया एंड वोमिटिंग, so it's mean that the patient have Vibrio cholera in their digestive system and have cholera disease. Traveling to affected areas and eating shellfish, as you know that shellfish is also responsible to spread the cholera or the bacteria. No distinguishing clinical manifestation for cholera. And the second method is differential diagnosis. Enterotoxigenic, as you know that a severe type of toxin secreted by the Vibrio cholera bacteria, so with the help of which we can diagnose. And bacterial food poisoning and viral gastroenteritis, these are the name of a diagnosis with the help of which we can easily diagnose the cholera or the bacteria. So to explain the treatment, the patient have given oral rehydrated salt, which is commonly known as ORS, oral rehydrated solution. Up to 80% of the cases can be treated through this. If the patient is severe, then intravenous fluid in the form of ringer lactate should be given. You know that this disease is caused by a bacteria Vibrio cholerae, so antibiotic can be used to kill the germs. So these are various types of methods with the help of which we can control the disease. Now we'll come go to the prevention of the disease. जैसा कि आपको मालूम है कि सफाई नहीं सिर्फ ईमान है, तो जितना हम सफाई सुथराई का ख्याल रखेंगे इतना ही हम इस डिजीज से दूर होंगे. So basic health condition and hygiene, mass chemoprophylaxis, provision of safe water and sanitation, comprehensive multidisciplinary approach, water, sanitation, education, and communication. These are the steps with the help of which we can eradicate the disease from the society very easily.